You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the place where I like to share my 30 plus years of experience as a dentist and many of those years working holistically to help educate you about oral health, overall health, and the impacts that dental materials and dental treatments can have on your well-being and the impact that your dental disease can have on your well-being. And one of the biggest focuses as a holistic dentist is practicing dentistry without mercury. And you might be going, what do you mean? Dentists don't use mercury, surely? Well, yes, they do. Those silver metal fillings that dentists put in your teeth or used to put in your teeth, but do not be fooled into thinking they still don't use it, that product contains at least 50%, if not more, mercury. So whilst dentists might not be using mercury-based fillings, known as amalgam or silver fillings within the profession, you may still have mercury-based fillings in your teeth. So if when you're brushing your teeth, you look in the mirror in the bathroom and open wide and you see silver or black-looking fillings in your teeth, they are 99.9% likely to be amalgam fillings that contain mercury. So what's all the fuss about mercury then? Well, if you didn't know, mercury is a highly toxic heavy metal. And it's so toxic, it can create a myriad and a really wide variety of health issues, and some can be quite serious, if not life-threatening. Now, don't misquote me, because I'm not saying that your dental fillings are the cause of the problem. But if you've got mercury leaking from your fillings, you are getting low-grade mercury toxicity and mercury poisoning. And mercury accumulates over time in your body, meaning that year upon year, those fillings are leaching mercury, it's building up, and it's having a detrimental effect on your system and your ability to stay well. And then if you've got other issues, poor health, poor diet, poor sleep, genetic factors, then you are much more at risk of poor health because you have mercury fillings. But unlike a lot of things that go on, this is like an ecological poison, but it's something you can do something about. In my experience, with many and often quite severely ill patients who have sensitivities, allergic reactions, autoimmune conditions, things like brain fog, unexplained symptoms, chronic fatigue, fibromyalgia, Meniere's, tinnitus, aches and pains, peripheral neuropathy. Many conditions have been supported by having their dental fillings removed. And many of my patients, and not just mine, but patients across the world who've had their amalgam fillings removed, will state that having their dental fillings was the single most effective method of improving their health. Now, if you want to know more, then obviously stay listening to this podcast, The Dental Zone with Dr. Rachel Hall, and you can hop on over to holisticdentistbrisbane.au to find out more or to contact me to make an appointment to get your amalgam fillings removed. So let's kind of look at pollution and environmental toxins, environmental poisons. So there's air pollution, there's poisons in our food, and there's toxins in our drinking water. Then you've got ecological disasters. We've had chemical spills recently reported in the US, and they make the front pages of the news and the papers, and they'll list all the disastrous substances that affect our health. And these are often beyond our control, and they're all killing us every day on a very slow kind of installment plan. And they have a single common characteristic. There's something you just can't do anything about. But in contrast to that, if you've got amalgam fillings in your teeth, that is something you can take charge of. You can get safe removal of your dental mercury, which is a major toxin. It's easily accessible, and you have a choice to take a preventative act of medical care that provides huge benefits at what would be considered relatively minimal costs. Now, should you take this poison out of your mouth or not? Now, dentists are exceedingly divided on this and how best to advise their patients. Now, your mercury silver fillings are only 30% silver and 50% or more mercury. The choice to name it silver fillings kind of clouds over the fact that these silver fillings are actually mainly mercury. And to call these fillings silver, in my opinion, is not only inaccurate, but it's actually grossly misleading. The fillings should at least be named by the metal which is in the greatest concentration, and in this case, that would be mercury. And we should call them for what they are, mercury fillings. Another misleading term that you've heard me use is amalgam. The great majority of people do not realise that amalgam is a solution of one or more metals in mercury. Amalgam is just another confusing name that the consumer does not realise means that they're receiving an implant of a toxin into their tooth. And your tooth is a living thing with nerves and blood vessels. And your mouth is also part of your body with lots of nerves and blood vessels and saliva that you swallow that goes directly down into your body. Now, if you're trying to make an educated choice, you're at a bit of a disadvantage as the patient or the consumer, because if I tell you I'm going to do a gold filling, you expect that filling to be made from gold. If I tell you you're going to have a silver filling, you would therefore naturally jump to the same conclusion. Yet there's a vast difference here, because a gold filling is gold coloured, has a small percentage of gold, and is made up of other metals as an alloy with no mercury. Yet a silver filling is about 30% silver in a solution of mercury liquid. Now, hands up, how many of us would have allowed somebody, aka the dentist, to have put poison fillings in your mouth if you'd been properly told that these fillings were called mercury fillings? If the dentist had said to you, okay, I'm going to put 50% mercury, known as a toxin or a poisonous substance, into your mouth, what are you going to say? I think most people are going to go, hell no. And I would agree. Now, this is a problem because dentists are divided as how to advise their patients. They're divided because in most cases, the manifestations of the disease of mercury poisoning only starts to become apparent 3 to 10 years after the insertion of the mercury into your teeth and body. The disease symptoms are insidious and they overlap with symptoms of many other diseases. Mercury poisoning is a great masquerader. It pretends to be something else. Now, dentists are not in a position to see the cause and effect relationship of placing the mercury and the development of an illness 3 to 10 years later. Even the patient themselves does not connect the illness to the original dental process. There is such a diversity and range of symptoms that occur in allergic disease, symptoms that the patient often does not connect to the source of the allergy, and many of these symptoms are equally applicable to the symptoms of poisoning from mercury vapor. So your allergic condition that you're being treated for as an allergy could actually be a symptom of mercury poisoning. Now, there are many patients who have identical symptoms who do not have either allergic disease or mercury poisoning. And these symptoms are not exclusive to the realm of mercury poisoning of allergy, and therefore this is why we see this overlap, and it makes it very hard to diagnose exactly why you may be having symptoms. And this is why the ability of mercury poisoning to kind of pretend to be something else is something that you should be aware of. I have seen many patients who actually don't even have teeth anymore and have no mercury fillings who have many symptoms. And it's possible because they've had mercury exposure and they've had mercury fillings in their teeth before they were removed, that they're now developing symptoms this 3 to a decade years later. In a patient with mercury fillings, it's actually quite impossible to predict whether removal of the mercury fillings will reverse some of the symptoms. There are no kind of diagnostic or long-term tests. There's very rare to have an allergic sensitivity to mercury, but it's not rare to have sensitivity to the toxic effects of mercury itself. And we're talking about biological sensitivity to a poison here and not an allergic reaction to a metal. The sickest patients I've seen are the ones who actually have combinations or mixes of different metals within their mouth. So they may have gold and other metals with the mercury fillings. They may have a metal denture. They may have metals in their crowns, and they may these days have metal implants. But the good news here is that in those cases, they often do really well after having the mercury removed. Now, the evidence supporting these and similar observations, whilst it is anecdotal, is actually quite vast. It's not just me saying it, it's many other dentists, it's many patients. There actually have been hundreds and hundreds of scientific references supporting these observations, and they just get ignored. The problem is that when dentists declare their practice is mercury free, this means that they're not going to be inserting mercury dental fillings into your mouth. But they're doing nothing to alleviate the fact that you've already got mercury fillings. And if you should ever need one of those fillings replacing, say it breaks, there's decay in the tooth, or the tooth itself breaks, they are going to drill on that tooth with very little to none whatsoever protection for you from the mercury that's going to come out of that filling while the tooth is getting worked on. And that for me is a big problem. Great step forward that dentists aren't using amalgam as much. Great step forward that they're recommending tooth-coloured fillings, but they're not recommending removal of the amalgam fillings, the mercury fillings that you already have. And when they do remove them, they do so in a fashion that is actually unsafe and very dangerous from the point of view of release, inhalation, and ingestion of mercury. But what I'm going to predict is that as time goes on, and I have seen this trend, more and more dentists will practice mercury-free dentistry, until that becomes the norm. Perhaps the use of mercury will be declared illegal, and then the matter is going to be settled. And then we can go on to a more productive activity as dental professionals rather than about arguing whether a poison is a poison. No matter how you wrap it up, no matter how you mix it or what you mix it with, mercury is poisonous. But what I would like to see going forward is that not only do dentists stop using it, not only do some of the bans that are starting to happen on the use of amalgam in limited populations and in limited areas, that becomes the norm. That we actually take a stand as a profession and go, you know what, this product is not safe. We did not know that at the time. Our training did not allow us to know that at the time. But hey, there's enough research now that we can come out and say we should not be using this, and we should all start now promoting the safe replacement of these amalgam fillings. So if you're new to the Dental Zone podcast, or you've not heard about holistic dentistry and you're curious and you want to know more, then I'm going to answer some of the basic questions. So what is a silver amalgam? Well, if you've listened to the first part of the show, they're referred to as silver fillings. It's the material that is most often, or was most often, used by dentists to fill cavities caused by tooth decay. Now, on the National Health Service in the UK, they will not pay a dentist or allow a dentist to put a white filling in a tooth unless it's your very front teeth. So every filling that NHS dentists do in the UK are amalgam in your back teeth. It is the same in the US because of dental insurance. Now, the term amalgam is a type of metal alloy or mixture which contains mercury, a poison that is more toxic than lead or arsenic. Let that sink in. Mercury is more toxic than lead or arsenic. Now, silver amalgam was developed by a British chemist in 1819, and it was originally made by filing down silver coins and mixing the filings with some mercury to make a paste or a soft, pliable mass. Today, modern amalgam also contains copper, tin, and zinc. The problem with calling this dental material silver amalgam is it does not make it obvious the fact that the major component is mercury. And as I've said, it should really be called a mercury filling. In fact, most people, including a great number of doctors and physicians, are not aware that all those silver fillings in their mouths each contain up to 50% of mercury. If they did, they may not choose to have it placed in their teeth. Now, why has this filling material been used for over 150 years by dentists, if not almost close to 200? Now, this pliable mass containing mercury, silver, and other metals undergoes a chemical reaction, causing the material to harden after it's been placed into the cavity in the tooth. Now, this was quite an innovation for the dental profession. It allowed greater numbers of people to be treated at less cost, because before they had mercury fillings, you could only really have a gold filling or your tooth out. Now, mercury fillings catapulted dentistry from what was basically a cottage industry serving only the wealthy to a health industry of what it is today, serving hundreds of millions of people in the world population. Are the mercury fillings safe? There is no simple answer to this question. In fact, it has been a question that's been asked for nearly 200 years of the use of mercury in dentistry. Mercury itself is known as a poison. It is also very volatile. This means that metallic mercury gives off mercury vapor when it's agitated, compressed, or exposed to increases in temperature. What happens to mercury fillings in your teeth? They're agitated by chewing, clenching, grinding. They're compressed by chewing, clenching and grinding, and they're exposed to increases in temperature because they're in our body and they get exposed to hot foods and drinks. Now, the mercury vapor that gets released is colourless, tasteless and odourless. You can't see it, you can't taste it, you can't smell it. If it gets inhaled into the lungs, it passes into your bloodstream and gets distributed to all your body tissues. Dentists have always been taught to believe that once the mercury has been combined into the filling material, it remains locked in and can't come out. Well, sadly, that is not the case, because that mercury leaks out of the filling. It vaporizes because it's exposed to friction, aka agitation, compression, chewing, clenching, grinding, and it's exposed to increases in temperature. In fact, as late as probably 1984, the American Dental Association was publishing information that stated when mercury is combined with the metals used in dental amalgam, its toxic properties are made harmless. Really? You suddenly mix something that's more toxic than lead and arsenic together, and ta-da! Some alchemical reaction takes place and renders it harmless? I find that a little bit hard to believe. And as a dental student, I found it hard to believe. But back when I was doing my dental studies in the late 80s, early 90s, there was no internet. There was nowhere we could look up information about dental amalgam other than in our textbooks and the dental journals that we were given. Then, in 1985, the statement was changed. Mercury is made virtually harmless when it combines with the other metals used to produce amalgam. Then, in 1991, that statement was again changed, and it reads, "It is important to note that mercury forms a biologically inactive substance when it combines with the other materials used to produce amalgam." Now, what does that even mean? What does that even mean? And the sad fact is that there's actually no scientific evidence to exist to support any of these statements. In fact, it's quite the opposite. Scientific data clearly demonstrates that dental amalgam is an unstable product. Is the ADA completely unaware of this fact? No, because I'll tell you why. How can I be so categorically blunt and adamant that they know for a fact that those statements are false? Because their fact sheet, their documents on the handling of mixed scrap amalgam, which are the bits that you don't use after you've completed the filling, states amalgam must be stored in an airtight container under X-ray fixer or similar chemical and disposed of as hazardous waste. Hello, hang on a minute. Something's not adding up here, is it? I've mixed up amalgam, imagine. I've placed it in your tooth and I've got scraps left over. Now, the bit that's suddenly in your tooth is non-poisonous, safe, inactive, biologically inactive, but the bits that aren't in your tooth have to be stored in an airtight container under special chemicals and labelled hazardous waste. Come on, it cannot be both, can it? It's either safe or it's dangerous. Now, till recently, myself included up until 20 odd years ago, we believed as dentists what we were taught in dental school. We followed that line. I'm not an American trained dentist, but in the UK and here in Australia, we were taught you mix the metals together and the mercury is now safe, that it is locked in, that it is now rendered null, void and harmless. It's not true, guys. We have all been lied to. So whilst you can point your finger at your dentist and blame them, as everybody does like to have a pop at dentists, you can't truly blame them because they were also lied to. And it's not just your health that's been put at risk, but theirs. Dentists are chronically exposed to mercury every day within their job, and they are oblivious to the fact that they are poisoning themselves through their profession. There is so much scientific evidence proving that the mercury does not stay locked in or bound into the filling, and that its toxic properties are not made harmless. There is research from the University of Calgary and the University of, I think it's called Roberts, maybe in New Zealand, clearly shows that mercury vapor escapes from the amalgam fillings in your teeth. Now, the Australian Dental Association, up until about 15 years ago, would still deny that. Then they changed their status or their, what they were saying about it to, mercury comes out from the filling, but don't worry about it because it's such a small amount. No, mercury is really toxic and there's no safe exposure limit at which it does not do any harm. So you can't have a threshold for if you only have this much mercury, it's okay, and anything over that's not okay. There is zero okay limit. Now, this confirmation that the mercury vapor and also metallic ions of mercury from the dental fillings that it escapes is provided by the World Health Organization in their Environmental Health Criteria 118 document on inorganic mercury. The WHO document clearly states that the largest estimated average daily intake and retention of mercury and mercury compounds in the general population, those who are not occupationally exposed, is from dental amalgams, not from food or air or the environment. And the average estimated daily intake of mercury from dental fillings, dental amalgams, is between 3.8 to 21 micrograms per day. That is huge. More startling than the WHO conclusions was a study done in 1992 by the University of Arizona demonstrating that 2/3, 66% of the body burden of mercury of those with dental amalgams appears to have derived originally from the mercury vapor released from their mercury fillings over time. There was a similar study completed in Germany, and his colleagues provided data demonstrating that the release of mercury from amalgam fillings represents the main source of mercury exposure in people with amalgam fillings. The significance of data from these studies is that the daily dose exposure required to give that large a tissue concentration is much greater than previously shown by intraoral or exhaled mercury vapor data. Consequently, rather than the overestimation of intraoral vapor the pro-amalgam experts would have everyone believe, it now appears that most of the published scientific studies have actually grossly underestimated the actual amount of mercury released from dental amalgam fillings. Now, further confirmation of this underestimation was provided by a German study in 1995. This is the largest test in the world on mercury release from amalgam fillings into saliva. It was done in Cologne in Germany. The saliva of 17,500 individuals was analysed for mercury content and related to the number of amalgam fillings each person had. The saliva of about 43% of the test subjects contained many times higher mercury levels than the 43 microgram maximum daily dose recommended by the World Health Organization. In fact, the leader of the study stated, in many test persons, the level of mercury was 10 to 100 times over the acceptable limit. The study further demonstrated that there was a statistical link between mercury concentration in the saliva and the number of amalgam fillings. That means the more fillings you have, the more mercury you have in your saliva. So how does the mercury end up in your saliva, and how does it end up in your body, and what causes it to escape? This is a great question, and science is continually producing new data and answers. For example, very little scientific significance was previously given to the unstimulated release of mercury from amalgam fillings. All the attention previously had been focused on the amount of mercury vapor released during actual stimulation by chewing. However, a study in Sweden concluded that the static unstimulated release of mercury vapor from amalgam fillings goes on 24 hours a day, 365 days a year, and is a major contributor to total mercury body burden. So what that study is saying is that you don't even have to stimulate the filling. The mercury is just coming out. It's going into your saliva. It's going into your body. It's going into your bloodstream. But the more you chew, the more you clench and grind, the more frequently you brush your teeth, the more frequently you have hot drinks and hot meals, then you are adding to the amount and the rapidity, the speed at which mercury gets released. In 1992, another study in Sweden found that fecal excretions, so your bowel movements, of mercury were 20 times greater than urinary excretion. So mercury passes through your bowel as well as your kidneys, but more so through your bowel. And moreover, that people with amalgam and a large number of fillings showed the excretion of total mercury that was 100 times larger than the mean intake of total mercury from a normal Swedish dietary intake. So it can't be coming from the food. It's far, far higher, 100 times higher. People with the average number of amalgams are predicted to show fecal total mercury excretion of 60 micrograms of mercury in 24 hours. And this exceeds the existing World Health Organization standard concerning the maximum allowable intake of total mercury from food, which is 45 micrograms of mercury in 24 hours. Many scientific research studies have demonstrated that large amounts of mercury vapor is released during chewing, and that this release continues for at least 90 minutes, if not for 2 hours, after the stimulation. That there is static, unstimulated release of mercury vapor that goes on continuously 24 hours a day, and that the body uptake from inorganic mercury swallowed with saliva can be as much as hundreds of micrograms per day for individuals with a large number of amalgam fillings. These studies should leave no doubt in anyone's mind that dental mercury in the saliva from amalgam dental fillings constitutes a real health problem. The exposure to the mercury exceeds any known standard from anywhere from 10 to 100 times, and that a significant amount of people have a total weekly uptake of mercury that is over the limit. And if you applied that to the United States alone, that would be something like 200 million people with amalgam being exposed to mercury levels that exceed established health standards. Whether stimulated release is caused by grinding and chewing action or an increase in temperature, it doesn't really matter. The important point to remember is that mercury vapor, ions, and abraded particles, which means you're chewing bits off your filling, are escaping and being inhaled and swallowed, as well as being absorbed by the oral and nasal linings. This is happening continuously during the lifetime of an amalgam filling. There's also another phenomena that occurs in the mouth that can contribute to the release of mercury, and this is called corrosion. Corrosion is similar to rust and means that surface particles of the filling are being chemically broken down and released into the mouth. Mercury vapor is released when you chew or grind, and in addition, minute rusted particles of the amalgam are being abraded and taken up by your food or saliva and then swallowed. These minute particles of mercury filling may be acted upon by intestinal enzymes and bacteria to produce methyl mercury, which is an even more toxic form than the elemental mercury that's placed in your filling. However, the significance of this effect has not been fully determined as of yet. Something that I find much more significant than the potential to produce the methyl mercury is the discovery that mercury from amalgam dental fillings causes a change in the gum and intestinal bacteria, microbiome or microflora. It changes them to become mercury resistant and antibiotic resistant. The fact that so many people are antibiotic resistant is something that has baffled and deeply concerned the medical profession, because it's creating so many serious problems in what the successful treatment of infectious diseases can be. And it may be that a lot of it is due to these bacteria being mercury defiant. So how do these fillings corrode or rust? Well, amalgam, like all other metals, when exposed to moisture and oxygen, will rust or oxidize. A car battery has two or more dissimilar metals suspended in an acidic solution. The corrosion that results produces free electrical currents. Those fillings in your mouth, in your acidic saliva, are creating a battery. That is creating electrical currents. Now, in your mouth, the amalgam fillings normally have 4 or 5 different metals. So that provides the dissimilar metals, and your saliva provides the electrolyte, which has various elements such as calcium, magnesium, potassium, and acid. So you have all the ingredients available in your mouth to create electrical currents, microbatteries. And these electrical currents can be measured. And this phenomenon is called oral galvanism. And that literally means that your mouth is like a small car battery or a miniature electrical generator. Now, when your miniature battery starts generating electrical current, the process of corroding, the breakdown of amalgam fillings, is increased. This increases both the amount of mercury vapor and the abraded particles that can be released into your oral cavity. It can also be very instrumental in the release of free mercury droplets from the filling. So does this oral galvanism cause other problems? Yes. But saying yes might just be a bit of an oversimplification. There is scientific evidence that in addition to amplifying the corrosion and mercury release problem, some individuals are very susceptible to internal electrical currents and EMFs. It is a very complex problem and scientists still don't have all the answers, and neither does the medical professional in that case. For instance, it's not really known whether the electrical currents themselves cause problems or whether the problems are being caused by the electrical currents forcing metal ions from mercury fillings into the cells and bones of the oral cavity, or causing their transport into the brain via the dental nerves called the trigeminal nerves, or by your veins, by your blood vessels and different pathways. There are a multitude of case histories that could be used to defend any of the arguments. From your standpoint as a patient, the important thing to know is that dissimilar metals in the mouth contribute to electrical activity and corrosion, and that in some individuals this can cause unexplained pain, ulcerations, inflammation, nervous symptoms, headaches, ringing your ears, and neurological problems like brain fog, short-term memory loss. Another aspect of this overall problem is that electrolytic corrosion is enhanced by other metals in your mouth, especially by gold. So if gold and mercury fillings are next door to each other, so you've got one tooth with a gold filling and one tooth next to it with a mercury filling, or the teeth above or below have gold and mercury in contact, this process speeds up. If there is a mercury filling under a gold crown, or a crown that has metal in, or that gold crown is in contact to or adjacent to the amalgam filling, it can increase the corrosion. It can increase the release of mercury particles and vapor into the mouth. And even standard dental textbooks warned against this for years. I remember reading it in my textbooks, and I remember reading it on the material information sheet that the amalgam manufacturing companies have to insert into the boxes of amalgam before you use them. So what's the position of the dental associations across the world on the release of mercury from amalgam fillings and its potential to harm humans? Well, the ADA, they sponsor workshops, they sponsor information, and they officially have acknowledged that mercury is released from the fillings. However, they went on to state that the amount released is so small it could not possibly cause any health problems except to those individuals who would be very rare and might be hypersensitive or allergic to mercury. And that position has essentially remained unchanged. In fact, in dental journals, dental associations have gone to great lengths to review articles of scientific literature and end with a conclusion that supports their official policy. I will read it for you. Occupational exposure to mercury is a potential hazard for dental personnel, but is completely preventable with the implementation of proper mercury hygiene practices. There is no evidence in the scientific literature that the minute amounts of mercury vapor that may be released from amalgam restorations cause mercury poisoning. Allergic reactions to mercury and other constituents of amalgam have been documented but are exceedingly rare. The association between allergies and oral lichen planus requires further investigation. Finally, dental amalgam, which has been used extensively for more than 150 years, has an exemplary record of safety and benefit to the dental patient. Now, oral lichen planus is an autoimmune condition that we'll often see in patients' mouths adjacent to where they have dental amalgams, but hey, there's no correlation now, is there? Despite the fact that when we remove amalgam fillings from these patients, their oral lichen planus tends to resolve very quickly. Now, there are several problems with this position statement from the dental associations, and one of them being that certain scientific studies that were very damaging to their position, i.e. they stated categorically that mercury from dental fillings releases at high volume and does cause toxicity and issues, these were omitted from their review literature. But additionally, none of the statements made by the Dental Association, which we can only conclude have been designed to lull the dental profession and you, the public, into a false sense of security regarding the continued use of amalgam, none of those can be substantiated scientifically. In a position paper in the Journal of American Dental Association in 1990, the adjusted ADA position on the safety of dental amalgam was stated: the strongest and most convincing support we have for the safety of dental amalgam is the fact that each year more than 100 million amalgam fillings are placed in the United States. And since amalgam has been used for more than 150 years, literally billions of amalgam fillings have been successfully used to restore decayed teeth. Think about that. The ADA is providing the worst kind of anecdotal evidence as scientific proof that amalgam fillings are safe, just because a lot of them have been used for a long time. What they're really saying is they have absolutely no scientific evidence proving that the mercury release from amalgam fillings is not causing mercury poisoning. The ADA, I believe, must be terribly concerned about the tenuous legal nature of their position on the safety of amalgam. Otherwise, there couldn't be any rational reason for their activity for revising the principles of ethics and code of professional conduct, making it in the US improper and unethical to remove amalgam restorations from the non-allergic patient for the alleged purpose of removing toxic substances from the body when such treatment is performed solely at the recommendation or suggestion of the dentist. However, it is a perfectly legal and acceptable procedure if the patient requests removal of their amalgam restorations. How can it be legal and acceptable and ethical and then suddenly become illegal and unethical if the dentist suggests it as opposed to the patient? It's absolutely mental. It makes absolutely no sense to me whatsoever. It's just doublespeak. It's absolute doublespeak. And what happened here in Australia was the Australian Dental Association said, we can't dictate to our members, our professionals, what they do or don't use or do not put into people's teeth. It has to be at their discretion. So what does that even mean? You know, there was a case in the US where the plaintiff claimed that he'd sustained injuries from exposure to mercury from his dental amalgams. Now, the defendants were his treating dentists, 2 amalgam manufacturers, an amalgam distributor, and the American Dental Association. The ADA eliminated itself from all responsibility. And in a legal brief filed with the court, the attorneys for the ADA made the following argument. The ADA owes no legal duty of care to protect the public from allegedly dangerous products used by dentists. The ADA did not manufacture, design, supply, or install the mercury-containing amalgams. The ADA does not control those who do. The ADA's only alleged involvement in the product was to provide information regarding its use. Dissemination of information relating to the practice of dentistry does not create a duty of care to protect the public from potential injury. Therefore, the ADA, the Association of the Dentists that is there for dentists, has just thrown the whole dental profession under the frickin' bus. Oh no, we're washing our hands. The dentist chose to use it, therefore they're culpable, even though we had all the position statements that told them it was perfectly safe. So here, the court agreed with the ADA and dismissed it from the case. Now, this information should send chills down the spines of all amalgam using dentists. In the face of ever-increasing scientific documentation that casts doubt on the safety of dental amalgam, the only defence for its use has been the unwavering support of organised dentistry. And this support has functioned rather like a security blanket, offering assurance of protection. But now, since this case, comes the revelation that in a court of law, organised dentistry washes its hands of legal responsibility and for the potential adverse effects from the use of amalgam, then putting the onus and the blame solely on the dentist. It is apparent that the dental associations are worried about their previous statements because they have spent a great deal of money lobbying to defeat their opponents. Their message to legislators is quite simple. Amalgam is safe. So why do you need to get the patient's consent? You can only get an informed consent signed when there is a potential risk. So they're saying that we don't even have to get informed consent from you, the patient. Therefore, I have every right to not tell you that is a mercury filling, that it is poisonous, and that it is potentially hazardous to your health and well-being. It is disgusting. And now it is possible in the US that dentists may be liable under law if their patients and staff members are not properly advised about what is in that mercury. Silver amalgams have been used for over 150 years. And they're trying to say that there's no concrete research that shows there should be a ban on amalgam or that it is toxic. And yet, they have advised dentists that they can't warn their patients about exposure to mercury from amalgam dental fillings, nor can they recommend its removal or replacement. The ADA, that's the American Dental Association, has been actively involved in assisting the boards of dentistry throughout the United States in attacking mercury-free dentists who have recognised the potential dangers of mercury dental fillings and have opted to practice without using mercury. Most complaints lodged to the dental boards are not from patients. They're not from the patients who have been treated by mercury-free dentists, but rather from other dentists in their own communities. Dentists are throwing each other under the bus. And when there has been no complainant, the Dental Association has gone as far as to make the complaint themselves. Such was the case with Dr. Hal Huggins, who was a leading proponent of amalgam, mercury-free dentistry, and research into the effects of dental amalgam on health and well-being. As a direct result of the unwarranted and bogus attacks on mercury-free dentists, we've now got citizen groups who have embarked on legislative remedies to help protect their right to seek dental treatment from whichever dentist they select, and to have their dental work performed in a manner that is not prejudicial to their health, i.e., most dentists who place amalgam, who respond to a patient's request to have their amalgams removed with no appreciation of the dangers of mercury vapour and consequently take no action to reduce their patient's exposure to this devastating poison, are now being highlighted. There is nothing that should deprive you, the dental patient, of the right to choose or replace any professionally recognised restorative material, nor to permit disciplinary action against a dentist solely for removing or replacing any professionally recognised restorative material. You should be aware that in the more than 125 years that the ADA has been in existence, it has not funded one single research project proving the biocompatibility or safety of dental amalgam in humans. The same can be said for dental boards and bodies like the Therapeutic Goods Administration and the FDA and the NIDR, which is the National Institutes of Health. None of them have funded dental research investigating the biocompatibility of dental materials. This means that for over 150 years, the dental profession has been placing mercury amalgam fillings in patients without ever verifying or determining its safety. There is conclusive scientific research showing direct correlation between the numbers and surfaces of amalgam fillings and the mercury content of brain tissue. There's a proliferation of hard scientific evidence clearly demonstrating very serious questions of safety and then the ethical considerations concerning further implantation of the poison of mercury via dental fillings into humans. This mercury in the brain tissue is a poison and it accumulates. What effect does that have on the brain? Could it be detrimental? Could it be hazardous? There's certainly that the ADA has no scientific proof that it isn't causing damage. They can't, for example, say with scientific authority that it isn't a contributing factor to emotional disorders, depression, or things like Alzheimer's disease. But quite the opposite appears to be true. Over the past several years, teams of medical researchers have been investigating Alzheimer's disease, and autopsy studies of the brains of people who died from Alzheimer's have demonstrated strikingly high levels of mercury. This presents the very puzzling question of how could these individuals, having no occupational exposure to mercury, all have high levels of mercury in their brains? How's that the case? You have to draw the conclusion that mercury exposure is coming from the dental amalgams. The release of mercury from dental amalgams makes the predominant contribution to human exposure to inorganic mercury, including mercury vapor in the general population. Okay, researchers have admitted that, but they have not drawn the link and they haven't said whether it is or isn't causing any damage. But they also have not said that it isn't. They have not said that mercury is not a poison, and they have not said that mercury being released from amalgam fillings is good for us. They have, however, stated that no amount of exposure to mercury vapor can be considered harmless. So it would appear that the dental boards and the dental associations, by amendment of its code of ethics, want to ensure that you continue to increase your body burden of mercury in the brain, pituitary, hypothalamus, thyroid, heart, lungs, liver, kidneys, and in pregnant women and in the tissues of your unborn babies. So before we point the finger at the dental professionals, the dentists themselves per se, we have to look at the governing bodies and their control over what we can and can't do, the threat of legislation and the threat of litigation. But that put to one side, mercury is placed in a class 1 poisons list. and amalgam alloy, which is mixed with the mercury to form amalgam, is placed in class 2. Neither component by itself can be used as a dental device, which is not in accordance with the law, as it requires each dental device to be safe and effective. If a class 1 or a class 2 substance can't be used by itself to fill a cavity, how can it be effective and approved dental device? The rationale behind not classifying dental amalgam is that it is a reaction product prepared in the dental office. So they're saying it's manufactured in the dental office and therefore it doesn't come under any laws and regulations. The amalgam manufacturer provides both components of dental amalgam in a single capsule. So in this capsule, there's a membrane that separates the mercury liquid from the metal alloy. The amalgam manufacturer determines how much mercury is placed in the capsule and the metallic content of the dental alloy also placed in the capsule. All the dentist or his or her staff can do is follow the exact instructions of the manufacturer in placing the capsule in a machine that mixes the two components together, producing the reaction product that is finally implanted in a living tooth. The dental staff have absolutely no control over determining the content of the mixed amalgam. It is patently clear that the FDA should have classified dental amalgam in class 3 and demanded that the amalgam manufacturer provide proof of the safety of the mixed amalgam implant. It does not appear that any such action will be taken. Every effort is being made to circumvent the need to determine the safety of mixed amalgam and to classify it by proposing to call mercury and the amalgam alloy a kit. The kit that would have the highest classification of any of its components, which would be the class 2 poisons category of the amalgam alloy. Classifying it as a kit avoids the need to determine the safety of the mixed reaction product that is finally implanted in the teeth of humans, and therefore this is how they get away with not classifying it as a poison and calling it safe. So there's a bit of the background on the history of how dental amalgam containing mercury has been allowed to circumvent all the rules and guidelines and ethical considerations and safety. You have to question what their motives are. You have to question why they don't just come out and simply state mercury releases from the fillings and they are no longer to be used, and these are the guidelines under which they should be handled when you're removing them. But no, that still hasn't happened, and holistic dentists and mercury-free dentists are marginalised and targeted by their profession for providing a service that we believe has exceedingly high health benefits for our patients. So I'm going to leave this episode here for today, but when I come back next time, I'm going to talk about what the potential health problems are that could be caused by mercury vapour that is escaping from the amalgam fillings. Because I think it's really important that for you, the end consumer, the patient who's getting these fillings implanted into their teeth or has them implanted into their teeth, that you understand the science, that you understand the politics, that you understand the collusion that has gone on, you understand how research is being manipulated with literature reviews, and how the dental associations are controlling what their members can and can't do. Now, thankfully here in Australia, things are a little bit different, but even so, I am still not allowed to recommend to my patients that they have their amalgams replaced. All I am allowed to do is present the facts, and then it is for you to put those dots together, make your own links, and make your own decisions. I'm Dr. Rachel Hall. This is the Dental Zone podcast. If you'd like to know more, hop on over to holisticdentistry.au. Thank you so much for joining me. This is going to be a series on dentistry without mercury. And in the next episode, I'm going to talk about the potential health problems of mercury vapor and ions that release from your fillings. Thank you so much for joining me. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.